Ask Terry Smythe about the power of rowing,
You're talking about a life-altering experience back in my days in college.
and you'll get a glimpse at her passion for giving life her all.
You know, rowing was a long journey for me. I didn't make an Olympic team, unfortunately, but I gave it my best for 1980 and 1984.
Terry rowed her way to the head coaching position at Michigan Tech University. She launched a rowing-centered fitness business with clients coast to coast and from all walks of life. And all the while, she fine-tuned her philosophy of balancing hard work with an appreciation for living every moment.
You know, the beauty about rowing, when you get the opportunity to row on the water, is it is literally a collision of spirituality, you know, that sense of moving a boat through calm waters, the sound of the oars.
Take a breath in and hold it.
Unfortunately, new sounds invaded Terry's life.
Found out I had cancer November 5th, 2013.
Breathe.
Her diagnosis, a rare cancer called mucosal melanoma, which accounts for just 1% of melanoma cases.
We're going to take you down the hall.
Although we do understand that skin melanoma is primarily driven by ultraviolet radiation and injury to the DNA, the mucosal melanomas tend to be, by and large, more aggressive disorders, more resistant to even conventional treatments. The melanoma originates not from the skin, but from the mucosal membranes in the body,
Which includes the linings of the sinuses, reproductive and gastrointestinal systems.
I mean, I had a terrible diagnosis, you know, rectal mucosal melanoma. Who wants to hear that? You know, nobody wants to talk about those things, but we need to talk about those things.
Ever the optimist, Terry had surgery in January of 2014 and thought her cancerous tumors had been removed.
So when I went back for my 3-month checkup, there was, you know, I had a lot of tumors in my liver, a couple of my lymph nodes, and that, again, progressed into my abdomen. It was scary. I was like, okay, now what?
So here are our PET scan. This is the October.
For starters, Terry found Dr. Svetomir Markovic, a Mayo Clinic oncologist and researcher who specializes in treating melanoma.
She's basically been through the gamut of accepted treatments. You know, she's had surgery, she's had drug therapy, she had failed treatments, and she was essentially left with experimental options. Any abdominal pain?
Right.
Call me.
But Dr. Markovic reassured her there were options.
You know, I was like, wow, there's hope. I have a plan B in my pocket. Loved his energy.
We're starting to see successes, even in patients with mucosal melanoma.
Dr. Markovic says after many decades of frustration trying to find effective melanoma therapies, recent discoveries in genomics and how the cancer's genes function sparked a revolutionary leap forward.
Began better understanding how the tumor regulated the human immune system that allowed it to grow and turn the tables now on the malignancy to fight it directly. So what we treated her was a combination of ipilimumab and nivolumab, a combination of a CTLA-4 inhibitor and an anti-PD-1 agent.
Essentially a 1-2 punch that makes Terry's tumor type far more vulnerable to the body's cancer-fighting abilities. Still, she was anxious about a particularly stubborn tumor between her pancreas and liver, and this PET scan would reveal if her immunotherapy combo was working.
It's all good, it's all good, it's all good, it's all good, it's all good. Yeah, it's still a couple of little ditzels in there, but you are doing fantastic.
Really?
Oh, yeah. There is no question.
Look at that.
Before.
Yeah. Oh, wow.
This is all cancer in the outer. And this is what's left of it. Nada. All this stuff gone.
Wow.
This is why I signed up to do what I do. This is the front line in the war on cancer, and we need victories like these.
Terry says, simply put, she and Dr. Markovic get each other. Perhaps, she says, it has something to do with understanding what it's like to pursue a passion with everything you've got.
He has the same passion for his work, and there's this brilliant man who is consumed with finding a cure for melanoma.
This is just so insanely important.
I'm not done living. You know, I'm a new grandma. I mean, she just turned a year old, and it's like, you know, I want to see her go to kindergarten. I'd love to see her go to college. You know, those things are highly, you know, motivating for me. But Terry she is truly exceptional, and I am privileged beyond words to have the opportunity to know her. Thank you. And help her.
For the Mayo Clinic News Network, I'm Dennis Douda.